Health experts say a new subvariant, sometimes called Stealth Omicron, is behind the increase, and they say it's just really getting started. News 12 Connecticut Sean McCabe has more on the BA.2 subvariant.
Some people have referred to it the stealth variant. Now we're referring to it as BA.2 variant.
U.S. officials now calling BA.2 a subvariant of concern as countries overseas grapple with a sudden increase in new COVID cases.
It's causing a significant bump in Europe, and what we typically see is we're about 2 to 3 weeks behind what Europe is going through.
Yale Medicine infectious disease doctor Dr. Sharon Stoll says the new subvariant is more infectious than standard Omicron. BA.2 first showed up in Connecticut in late January.
Right now, the subvariant accounts for about 35% of cases. I think it'll become the predominant strain in the next 2 to 3 weeks.
Data from Europe suggests the new subvariant causes less severe disease than previous forms. Dr. Stoll says we'll be partly protected by leftover immunity from the Omicron wave.
This isn't going to be a shock like the original pandemic or the original COVID outbreak was, because a lot of our systems have been exposed to this before.
But she says a rise in cases is likely over the next few weeks, and the most vulnerable are still at risk.
Yes, we need to get back to some sense of normalcy, but we also have to have some degree of awareness and precaution.
Stoll says COVID-19 will be with us for years to come, and so will masks and other safety precautions.
Similar to our children needing to wear those bike helmets or helmets when skiing, which wasn't the case even 20 years ago.
Sean McCabe, News 12 Connecticut.
All right, Sean, thank you. The CDC says 35% of new infections in the U.S. last week were due to the new subvariant.